Two major health insurance agencies affirmed that they will continue to cover all of the CDC's previously recommended vaccines, including the hepatitis B vaccine for infants. This news comes even though the CDC's immunization advisors voted last week to overturn a decades-long recommendation that newborns be immunized for hepatitis B, a policy credited with nearly eliminating the highly contagious and dangerous virus in infants. Blue Cross Blue Shield Association and AHIP said they will continue to cover all vaccines recommended by the committee as of earlier this year, with no cost sharing through 2026, according to CNN. The CDC's decision came from the committee handpicked by Health and Human Services Secretary Robert F. Kennedy Jr., a longtime vaccine skeptic. The members of the Advisory Committee on Immunization Practices, or ACIP, who voted for the new guidance, argued that there were insufficient trials to prove the safety of the vaccine, a claim that has been widely debunked. Susan J. Cressley, the president of the American Academy of Pediatrics, called the committee's guidance irresponsible and purposely misleading, saying that it will lead to more infections in infants and children. The AAP is continuing to recommend the hepatitis B vaccine at birth. The committee's new recommendations still include a dose of the vaccine within the first 24 hours of life for infants born to hepatitis B positive mothers. But for mothers testing negative, they recommend individual-based decision-making in consultation with a healthcare provider. The hepatitis vaccine is required for school attendance in the vast majority of states. The decision could impact not only the vaccine's availability, but also its accessibility beyond next year, since both public and private health insurers look to these policies to determine coverage. The hepatitis vaccine was first recommended by ACIP in 1982. Before that point, an estimated 200,000 to 300,000 people, including about 20,000 children, were infected with the highly contagious virus each year. The new guidance is dangerous for infants who have a 90% chance of developing liver cancer or chronic liver disease if they contract the virus, according to experts. For 4 and 5-year-olds, that chance remains high at 30 to 40%.